Now, so I want to give you a little protocol. I wanted to tell you just for a minute, I don't want to take any time with this, but I know that you need to know a little bit about who I am. When I was 22, I had a uterine tumor which I cured myself knowing nothing. Just changing my diet, changing my thinking, working with my faith, and just creating positivity in my mind. It's hard to cure anything if your mind is deluged with negative thoughts all day long, you see? So your thinking has a lot to do with your overall health. That's one of the most important things. But what we do when I train doctors, which I do full-time, 11 hours a day, we train them in using my saliva test that I created. It's more accurate than blood testing, and it gives a very accurate reading on the free unbound hormones in the body, whereas the blood shows the free, it doesn't show free hormone, it shows bound proteins, so that you can't really determine or tell the actual accurate levels of hormones unless you do a saliva test. And the difference is between night and day. So we train people to do, and doctors to use the saliva test. We also have them available here for consumers should you want to do one for yourself. Because you don't really need a doctor. I mean, you get a program back that tells you everything you need to do right in the program. So, and it's all natural, completely natural, okay? And then what we do is we use the hormone rejuvenation, EndoPure. We balance the neurotransmitters with NeuroBalance Pro. It's homeopathic. So EndoPure is homeopathic. NeuroBalance Pro is homeopathic. I have created 150 homeopathic remedies to heal humanity because the way things are going with medications and drugs, you've got to be on top of this. And so we also have remedies for homeopathic remedies to help heal and release emotional issues so that it'll drain them out of your body. When you're having a lot of anger or fear or disgust, despair, low self-esteem, grief, shock, overwhelm, whatever it may be, you need a remedy to help you to release it, especially if it comes back often and if it's a primary emotion that you have. So homeopathy is the best thing in the world to help you with that. And then there's detoxification that we're going to go over, and how to deal with allergies and how to get your allergies healed. We're going to be talking about a little bit about mercury and heavy metals today, and to rebuild the digestive system, and also to heal the aging process of the body, and to actually reverse the biological aging. The chronological aging isn't important, but the biological aging is very important. In other words, I've worked with people 34 years old who had a biological age of 70. Okay, because their liver and their kidneys were toxic and the body wasn't working. Please turn your cell phone off. Thank you. Okay, and the next one is I want to talk to you very briefly about hormones and what the difference is. It's mine. It'll go away. Take it out of there and just turn it off. Okay. I thought that ring sounded familiar. All right. We look at HRT and BHRT. I'm going to show you the facts of what bioidentical hormones do to your bodies. You need to know this. You need to see this. You may hear about it, but that's not good enough. You may see charts and graphs about it, but that's not good enough. I'm going to show you actual patients' saliva tests and show you what they're taking and what that produced in their body. Now, I have 20,000 saliva tests before and after with 20,000 doctors that I have worked with. So 20,000 saliva tests before and after. That proves it. I have really hard research, more so than any pharmacy ever puts out about their drugs. Do they do a trial with 20,000 people? Not really. Maybe if they do 100 or 200, that's a lot. Well, what can you tell with that? So that's all deliberately done that way. So a compounded hormone is a synthetic hormone. Even though it's from a natural source, the mere fact of compounding creates a synthetic out of the product, even if it's from a natural source. Okay? So so-called bioidentical hormones do not work identically to how our body produces hormones. Why? Because of our chronobiology, the way that our body and our circadian rhythm works to create the hormones that we need to make at different times of the day or night. Bioidentical hormone stops the chronobiology. You put a hormone on your body says, okay, I have what I need today, and it kind of messes that whole process up, and then your body becomes dependent on it. So it's a drug that your body and your brain and your body is dependent on in order to function. You never want to get yourself into a situation like that. So the BHRT or HRT causes a dependency. It ages the body by slowing and eventually shutting down its own ability to make hormones. Example of that is thyroid meds. Well, a lot of people don't use the knowledge they already have to explain or to understand what's happening with the HRT and BHRT. So you all know, I know you know this, that thyroid hormones, when you take medications, the doctor tells you your thyroid's going to go to sleep now, i.e. it's not going to work. Why? Because you're putting thyroid hormone in your body that's going to take the place of what your thyroid normally does. It works exactly the same way for any hormone. The issue is you take a hormone, your body stops making its own hormone or whatever you're taking. Okay? It gets lazy. That is the key to what I'm telling you. Now, natural bioidentical and synthetic HRT proven side effects. It's proven, according to before and after testing, which I'm going to show you, okay? It's proven that the body shuts down production of its own natural hormones, causes dependency and aging, causes a toxic burden to the entire body, including the liver, kidneys, blood, and the immune system, causes toxic levels of hormones, elevated levels of hormones, and, of course, adrenal stress. Your adrenal glands don't like you to do that. When you reach a certain age, and if your doctor says to you, well, your body's not making hormones anymore, that is an absolute lie. You make hormones until the day you die, of course. As you get older, your body makes less and less. Your ovaries make less and less and less and less until they nearly stop. But your adrenal glands never stop. When has your doctor ever told you that your adrenal glands will make all the hormones that you need? I've never heard anybody be told that, yet it's the truth. So we have to be really nice to our adrenal glands, understand them really well, make good friends with them, and give them what they need in order to create optimal wellness. This way they will produce all the hormones that you need. So hormones basically are messengers that tell your body how to feel physically and emotionally. Okay? The only hormones that are truly natural are the ones your body produces. I don't have natural hormones for you. I have a solution that makes your body make its own hormones, even if you've had a complete hysterectomy. Why? Because your adrenal glands makes your own hormones. That's why. Okay, so hormone production in the aging process is not related to how old you are, but how healthy you are. What is your biological age? You can take the test in my book, Revitalize Your Hormones. I've got beautiful biological age test to find out your real age. And so BHRT or HRT cannot replicate the 24-hour circadian rhythm of our own hormone production. Our body does not react or utilize any hormone replacement like it is our biological hormone. It doesn't exist. It will never exist. Why? Because your body's hormones are unique to you, and they are produced at different amounts from the moment you get up in the morning to the time you go to bed at night. And there are certain key times related to certain hormones. It has been proven that BHRT is toxic to the body, therefore our body doesn't react to it as if it were identical to our own. And this is what you're going to see. Finally, certain hormones, for example, progesterone, estrogen, DHEA, and testosterone, are produced at their highest amounts at completely different times of the day and evening. From morning, day, to evening, hormone levels change according to our 24-hour circadian rhythm cycle and how we handle and process stress. This is called your chronobiology. How your body handles stress, the 24-hour circadian rhythm. When you take hormones, that rhythm that's normal to you is skewed. And that's why we have problems. So homeopathy has been around for 200 years. It has no side effects. You taking less of it is better than more of it, always. That's why you don't need a whole lot, and you don't need it forever. And people think when they start using homeopathic hormone rejuvenation that they're going to have to use it forever, just like the medication, but that's not true. It heals the body. Then you don't need it, okay? However, sometimes you can take it and it will heal the body and help the body and normalize hormones. But then let's say 6, 8 months, a year down the road, you have stress in your life. You have a divorce, a marriage, children, grandchildren, changes in job, whatever stress there is that can precipitate hot flashes or other kinds of hormonal situations, then you can just start taking it again, because it can't do any harm. So you can take it, stop it, take it, stop it. What we recommend is for the first 3 months that you take it and follow the program according to a saliva test if you want to do one of those. If you don't want to do one of those, then we just help you to see which ones you need by reading the directions on the box, or you could even take the homeopathic progesterone, homeopathic estrogen, and all the good estrogens, or homeopathic testosterone. Some women who have severe hot flashes where when they wake up in the morning or in the middle of the night, their whole bed is soaked, okay? Then oftentimes I will recommend to their doctor or to my patient that they use all 3, but not every day, 5 days a week, 4 days a week. You don't need it every day, okay, until it shifts and until that condition is not there any longer. But what you need to know are what are the causes of endocrine breakdown. We talked about one of them before in the panel, before the radiation panel. Nuclear radiation is going to severely affect your endocrine system, your thinking, your processing. And radiation sickness, if you've never experienced that, I will tell you about that tomorrow when I do a lecture on radiation, so we can work about that in more depth. This had to be broken up into 2 parts because there's so much information to give you. Now, the endocrine system, think about the neuroendocrine system, okay? Your mind, your neurotransmitters, okay? Think about the hormones and how they're affected by the adrenal glands. Radiation is a big stressor on the adrenal glands, okay? So what we talked about the last hour I agree with, but there are some modifications that I don't exactly agree with because I lived through it that I'm going to present tomorrow that I would love to share with you. But we're looking at adrenal exhaustion, scar tissue, environmental issues, emotional identities, EMFs, which are from cell phones, which do affect neurotransmitters in your brain. That's where they are. You've got your dental mercury toxicity, you've got other heavy metal toxicity, and the radiation, and all of these things are causes of endocrine breakdown. They're all related to one kind of a stress or another. You should be doing like a mental, sort of a mental cleansing, and take a look and write down all of the stresses or stressors in your life, and see what you can do to change the way you think about those things or eliminate those things, if possible, from your life. Stress is the uncomfortable gap between how you would like our life to be and how it actually is. That's why people are stressed out. Well, your goal is to have your life be a certain way, right? But it's not that way right now. And instead of letting go and being in the present, you're living in that gap. Well, it's not where it should be here, and why isn't it here yet? You're doing that. People do that, okay? And just be in the present, be happy where you are now. You could still have a goal, but you don't need to live in that gap. So if we look at the gap that's persistent and growing despite our efforts to reduce it, then our distress becomes acute, taking such forms as anxiety, fear, frustration, depression, and or despair. Of course, we've got your emotions like anger and frustration and resentment. We've got all of these emotions related to the organs. This is according to the 5-element theory of Chinese medicine, which is 2,000 years old. All of that is in my book, Revitalize Your Hormones, and my first book, Transform Your Emotional DNA. Identifying stressors, as I was talking about, how you perceive your life, your family, your health. Perceptions are emotionally driven, stemming from belief systems and anchored by identities. Your genetic blueprint. What about genes? Have you ever heard of epigenetics? Okay, just because you have cancer in your family doesn't mean that you're going to get it or that you have to get it. There's no truth to that. If you don't support the same behavior genetically as mother, father, whoever had cancer, okay, then you won't get it. You have to change your life. Nothing good happens without some change. People go, oh no, change, no, anything but that. But that's really true. You have to change your life. So stress causes, all of these different health issues. It's a component to all disease, mental, emotional, and physical. It creates a burdened immune system, premenopause, menopause, hot flashes, mood swings, weight gain, arthritis, depression, hair loss, constipation, and more. Biological age versus chronological age. Organ health determines biological age. If your organs are toxic, your biological age is going to be older. Your skin will reflect that. You'll have more wrinkles. Your adrenal cortisol levels are affected by stress and thus do not produce the correct amount of hormones affecting hormone ratios. So we want to look at cortisol levels. You know what cortisol is? Anyone have a question about what it is? Okay, your adrenal glands make cortisol. It's a hormone, and it's a stress hormone. Okay, sometimes people have very elevated levels of cortisol in their saliva testing. Okay, and when it's very elevated above normal, it can be an indicator for hypoglycemia or diabetes, or a predisposition to diabetes. So cortisol is key. Keeping cortisol levels at a normal range. That's why doing a saliva test is so fundamentally the best thing to do. This way you'll know the truth. So elevated cortisol levels equals weight gain. People who have a lot of weight on them have higher cortisol levels. I test 5 of them, one for each element in the 5-element theory of Chinese medicine, which tells me the health of your organs, glands, meridians, and emotions. So we want to look at EndoPure as being the hormone rejuvenation that balances the HPA axis, which is the hypothalamus, pituitary, and adrenal axis. The HPA axis is why women have, when that's out of balance, it's why you have hot flashes. It's why you have insomnia. It's why you have severe or even slight menopausal symptoms. The HPA axis has to be out of balance in order for you to have those kinds of symptoms. What does it take to get that axis back in balance? EndoPure. That's why I designed it that way. It's FDA registered and approved. So then we have the BioAge Reverse. We can balance the human growth hormone, blood sugar, adrenal function. So again, we have thousands of saliva tests. You know, when I first started doing this and working with, thinking about, you know, oh, I've got to make homeopathic remedies for this, I decided that even though homeopathy has a 200-year great history of working, even so, I wasn't sure how it would work specifically for various hormones like your progesterone or testosterone or your good estrogens. That's why I decided to do the saliva testing so that I could see what was happening. So we have over 20,000 tests before and after. Now this is the results from a woman with bioidentical hormones. These are actual patients' slides with her permission. I am showing this. Note the testosterone, DHEA, progesterone, and estradiol, excuse me, which I will point out. Patient's symptoms are chronic and acute aggressive, very, very aggressive anger, hair loss, weight gain, emotional hot flashes, and she just felt like she was a completely different person, and she didn't recognize herself. And here's why. Danielle, if we look at the very top, and I'm going to, here's the pointer. So there's 5 cortisols, okay? Her cortisol levels were not too bad. They were at the low end of low normal and high normal. All of them were not exactly good. They weren't at their optimal levels. But they weren't that bad either. And the DHEA was not too bad, but when you look at her testosterone, it shouldn't be above 63. It should actually be about 45, 50, and hers was 88.8. Now, 88.8 is extremely elevated testosterone levels, and that's what is causing her anger and her anger frustration. Now, her progesterone is 1,863, and it should not be over 97 as a high. And she was on so-called bioidentical progesterone. So this is really sad, and what's really sad is that the public is being marketed to, they are being sold a line of, I don't want to say it, but it's just crap, you know, just really they've been sold something that doesn't hold up and that can easily be verified if the patient speaks up and says, do a saliva test, let me see the truth. Show me your patients. Show me what their reference ranges are and what their saliva test results look like before I take what you want to give me. But people generally don't do that. Now, the estradiol was 3.3. That shouldn't have been more than 3.1 so that was just a little bit high. No, that's 2.0. And of course, I was doing a lot of research with doing a saliva TSH. And so that was just a little bit of research I was doing, and her TSH was low. So when you do a saliva test, I write a natural program for you to help you to do the right program so that you're going to get results, because it's about detoxifying. If any of you have been on any hormones of any kind, then your body needs to be detoxed. That's just the reality. Okay, there was another one that we missed. Yeah, this is the one we missed. This is Danielle. Her cortisol levels, if you look, these are all the ones that are abnormal. You've got your 34.4, 6.4, 4.2. Those are all abnormal levels. Her DHEA shouldn't be over 5.5, 6, maybe 7 for optimal reference ranges. The lab gives it up to 10. This is 12.80. This is too high. She was taking DHEA. I don't recommend ever using DHEA, melatonin, or any hormone on or in your body. Okay, her testosterone shouldn't have been higher than 60, and it was 693.6. I see these things every day. That's why I feel passionate about being here with you. Now, if you look at her estradiol, which shouldn't be over 1.5 for her age and her state of menopause, hers is 13.5. That's very, very dangerous to have an estradiol that level. It's all dangerous because things develop after this, you know? And if it stays like this for very long and gets worse, then cancer. Then you get cancer. This is a woman, 36 years old. If you think, oh, this is only for menopausal women. No, this woman was 36. She had infertility. She wanted to get pregnant. And so her husband was an MD, came to me and said, I have my wife on progesterone cream. Let's see what happens and do a test and see what's going on. So her test, her cortisols, 2 of them were out of balance. DHEA was okay, testosterone okay, but her progesterone was 6,650. Now, that shouldn't be over 200. That's the high 200. Hers was 6,650 from using progesterone cream from a health food store. Hello? Okay, and that pushed, all that progesterone pushed her estradiol down to 0.9, so she had no estrogen. You can't get pregnant without estrogen. You have to have it. It's one of those things, right? Okay, so this is her after test. She did get pregnant. I've gotten a lot of women pregnant. If I was a guy, I'd probably be sending my little things on pictures, little lewd pictures on Twitter, you know? I mean, I have gotten so many women pregnant. We do very, very well in my center at helping women with infertility. So we're looking at the second test, her after test. Well, we brought her progesterone down in 5 months to 74.4, which was okay, good. But the most important value here is we got her estrogen up using homeopathy to 1.6, which is good for her, nice and healthy, and she got pregnant thereafter. This is a woman who has a complete hysterectomy, type A person, type A. And she runs a major corporation, and she was on the patch and wanted to get off of the patch because her mother had cancer. And so she decided to change those epigenetics and to work with epigenetics. See, this was a number of years ago. And so her cortisols, she had 2 cortisols out of balance. DHEA was too low. Testosterone was okay. Progesterone was okay, pretty good, not too bad. But her estradiol was a couple of points too high. Okay? And so she had, we got her off of the patch, and we had to get her adrenal glands working so that her body would make the right amount of hormones. So this is her after test showing that a person with a complete hysterectomy on no hormones has perfect adrenal glands. Perfect. Okay, type A person runs a company. So it can be done, but she's not the only one. It's the only test I have time. I don't have time to show you, thousands of tests. But I like, this was a woman that I like very much, and she really worked hard, and she travels all over the world, and she did it the right way anyway, okay? So her progesterone is perfect, and her estradiol is what it should be 2.0. That's how picky I am, But hers was a little higher, so she was very happy, and that was after 6 months. So we know that her body is making her adrenal glands are making their own hormones. So we have a new 5-element saliva test that includes everything you really need: your estradiol, progesterone, DHEA, food intolerances, LH, luteinizing hormone, follicle-stimulating hormone, gliadin, which is gluten intolerance, and food intolerances, testosterone, 5 cortisol levels, and they're all done at the correct time, so we can see meridians, organs, glands, we can see everything that's going on in your body. There's a toxicity report I want to give you very quickly. I only have about 5 minutes left. And I do want to open it up for questions, just taking a couple, and then I can meet you at my booth. I have booth 425, and I will be there for you. You can be sure of that. Okay? So HRT toxicity report, progesterone toxicity symptoms. So not many people will show you the actual toxicity of what happens when you use too much progesterone on your body or in your body or use any hormones. But it causes weight gain, hair loss, loss of libido, depression, endocrine dysfunction, risk of cancer, and there's many other potential risks, and adrenal stress. So also we have the estrogen toxicity report here, which we know causes breast lumps, uterine problems, ovarian tumors, risk of cancer, depression, weight gain, excessive facial hair, gallstone risk, heart attacks, strokes, and adrenal stress. There's no reason why you need to use any HRT, none. And people actually come to me and say, I have such a nice doctor, I'm taking it because he or she is telling me to take it. And I have to ask you to evaluate that. Doesn't matter, it's not a personal thing, it doesn't matter how nice your doctor is. What matters is, are you going to take care of yourself and do the right thing? And it's about education. So why risk estrogen dominance? Okay, and so the EndoPure 2, which is the EndoPure Estro, actually detoxifies estrogen dominance. So when a woman is in danger of having cancer or has had cancer because of elevated estrogens, the EndoPure 2 and a detoxification program that I've created gets it out. Detoxing makes your body younger, your mind sharper, your attitude better, and have a happier life. So do it every 6 months for the best possible life. Obesity and weight loss, very, very briefly, I'm going to share with you that HCG is a I've made it up homeopathically in Fibonacci. Has anyone here ever heard of Fibonacci in math? Oh, good. Well, I use the same exact numbers, Fibonacci numbers, to create and produce the homeopathic HCG. It is fantastic, has no side effects, and it works for weight loss. However, I don't recommend the 500-calorie diet. Not enough calories, not enough fat for your brain to work. You need to do 900, 1,000 calories for a short period of time, like 28 days. So I'll be talking about that as well on Sunday. On Sunday, I have I think at 2 o'clock on Sunday. So the 500-calorie diet has severe side effects. Caffeine, you don't want to drink if you're using homeopathic remedies. The HCG Slim Kit includes everything you need to balance your blood sugar, help you to not be so hungry all the time, and to amp up your metabolism in a healthy way, and it's completely homeopathic and safe. So to detoxify, very briefly, you've got your whole body deep cleanse, or you've got the slow cleanse, which is for a month. People who are critically ill that I help, or when I work with hospitals and the outpatient clinics of hospitals and training the physicians, we use a version of this, which is the 1 month or 2 month or 3 month slow cleanse. And this is all organic herbs from the United States in veggie caps, no heavy metals, nothing in it but what I just said, okay? So there's no excipients. And the slow cleanse for a month will help you a lot. If you have a serious health problem, then the slow cleanse for 3 months would be the best thing to do. It also helps you lose weight, but if you're already thin and you don't need to lose weight, it won't make you lose weight. A lot of people do have a problem in that area as well. If you have parasites, I deal with so many people with parasites. When a person has cancer or a serious health issue, most of the time when I test them, they will present with symptoms of candida, of parasites, of molds, which are called mycotoxins, okay? So we need to be aware of that, and I do have parasite formulas that are both homeopathic, and I have some that are herbal. They handle different types of parasites, and as well as a candida formula with the 4 most prevalent types of homeopathic remedies for the 4 most prevalent types of candida. So we want to rebuild the body, reduce the biological age, and do an anti-inflammatory diet. This is in my book, okay, and this comes with the saliva test program. It's a similar diet. So you want to eat low on the food chain. You want to, if you eat fish, I eat salmon. I don't eat cheese. If you want an anti-inflammatory diet, don't eat cheese, don't eat milk products. Even if it's raw, don't eat it, okay, because it makes mucus. Even raw cheese makes mucus, okay? Whey is an inflammatory. Whey can be hard if you have arthritis and you're having whey and you're finding that you still have arthritis, then switch to hemp protein. Hemp protein, cleaner protein. So basically, there's a lot of information here, and the All Flu is the homeopathic flu remedy that handles a West Nile virus, bird flu, influenzainum A, B, C, tuberculinum aviare, which is bird flu. It has everything in it for a preventative to prevent your getting the flu. Like a vaccination, only non-toxic, and you only need to do it once a month as a vaccine, once a month, adults and children. So we're just about at the end here, and I want to thank you very much and open it up to questions. Any questions? Yes? Oh yes, oh yes. The radiation is part of the environment, because all these different things from your environment will affect the endocrine system, including the radiation. And that's why I have a radiation formula called, it's called Homeopathic Radiation, and I have it at my booth, and I also have the diet for you, if you'd like to get that. Okay, so we're going to have to end